good afternoon, depending on where you are. I am Stacia Johnston, Director of Health Equity Advancement at the American College of Lifestyle Medicine. I am one of the speakers for today of the webinar and wanted to be the first to welcome all of you. We may have some people still trickling in, but please go ahead and light up the chat. It should be enabled. We'd love to know what institution you're from and what you teach. So please go ahead and enter the information in the chat. Next slide, please. Again, we may still be waiting for some people, but we are going to dive right in. These are the group of speakers who have volunteered to speak about the very important work we're doing to bring lifestyle medicine to health professions programs across the country. They all have a unique story to tell about their journey to lifestyle medicine and how it has impacted their work as health professionals. Next slide, please. So here are the objectives that we'll focus on today. I won't read them for you because I'm sure you have been prepared if you registered for the webinar. Excited to get to dive into these objectives. Next slide, please. Now let's talk a little bit about the American College of Lifestyle Medicine. Some of you may be new to our organization, so I'll give you a high-level definition of what we do and who we are. ACLM, or the American College of Lifestyle Medicine, is a nonprofit professional medical association that represents a galvanized force for change. We were founded a little over 20 years ago in 2004 and have been recognized as one of the fastest growing medical associations in America. Our mission is to advance evidence-based lifestyle medicine to treat, reverse, and prevent chronic disease. And our vision is a world wherein lifestyle medicine is the foundation of health and all healthcare. So let's dive right in. Lifestyle change as the first treatment option. Many of you likely know that clinical guidelines and recommendations state that lifestyle changes should be the first prescription, if you will, for both prevention and treatment of many chronic conditions, including type 2 diabetes, cardiovascular disease, hypertension, cognitive impairment, obesity, and even some cancers. The pillars of lifestyle medicine are often recommended in treatment guidelines before any medication is prescribed and even used to enhance medications or surgical interventions. Next slide, please. So for the sake of this webinar, I thought we just I go into the definition of lifestyle medicine just so we all have a shared understanding of what we mean when we say lifestyle medicine. At ACLM, our staff and nearly 15,000 members believe that lifestyle medicine is the solution. So what is lifestyle medicine? Lifestyle medicine is a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions. Many of them I listed earlier, but I'll share them again. Including, but not limited to, cardiovascular diseases, type 2 diabetes, and obesity. Lifestyle medicine certified clinicians, some of whom are on this call today, are trained to apply evidence-based, whole-person, prescriptive lifestyle medicine to treat, and when used intensively, often reverse some of these conditions. Applying the 6 pillars of lifestyle medicine, which are listed on the slide, also provide effective prevention for these conditions. Next slide, please. Now that we've defined lifestyle medicine, which many of you may already be aware of, I also want to discuss why we're here today, and that's the Academics Pathways Program. I'll define the Academic Pathways Program at a very high level because my colleague Kelly Freeman, who is ACLM's Director of Workforce Development, will give you a deeper dive today and later in the presentation. The Academic Pathways Program is an opportunity to embed lifestyle medicine into master's and doctoral programs for nursing, pharmacy, nutrition, public health, behavioral health, and other related fields. The academic pathways will prepare your students for lifestyle medicine certification while they're still in school. So you'll hear testimony from some of our speakers today who share that they wish they had lifestyle medicine training while they were in school. And the academic pathways achieves this. By aligning your curriculum with ACLM's core competencies, your students gain a powerful head start into the only medical specialty focused on treating the root cause of chronic disease, and that's lifestyle medicine. Next slide, please. Thank you to all of you who have introduced yourself in the chat. If you haven't done so already, please go ahead and share what institution you're representing and what program you're teaching. And as we dive into the presentation, I want to remind all of you that the chat is enabled and you're more than welcome to ask questions in the chat and also make comments throughout the presentation. We'll be answering the questions live in the chat. And for questions specific to a speaker, they will respond to the questions in the chat after their presentation. Next slide, please. Now for a few more definitions, just for framing, because it's likely that this group knows what we mean when we say underrepresented in medicine. UIM refers to specific racial and ethnic populations that are not adequately represented in the medical profession compared to the numbers in the general population. So let's start off with some nursing statistics. Nurses represent the largest percentage of the U.S. healthcare workforce, yet the nursing profession continues to grapple with a lack of diversity. According to a 2022 study that was highlighted in American Nurse, most U.S. nurses, about 81%, identified as white female, while Asians, Blacks, and Hispanics accounted for less than 10% of all registered nurses, respectively, as you can see on the slide. Also on the slide, you'll see that the number of registered nurses is less than 1% for both Native Americans or Alaska Natives and Native Hawaiians or other Pacific Islanders. While this slide represents statistics just for nurses, we know that these disparities in representation are reflective of healthcare professionals throughout the system, no matter the discipline. So why is this happening? Well, 3 solid examples include discrimination. Ongoing racial and ethnic biases can hinder access to medical education and career development and advancement. Also, financial barriers. Economic challenges can limit opportunities for education and training in the medical field. And the lack of support and mentorship. Insufficient mentorship and resources for UIM students can affect their success and retention in medical programs. Next slide, please. So let's pivot a little bit and talk about the importance of diversity in medicine. We know that diversity in healthcare helps to combat health disparities and achieve health equity, which improves the health and well-being of all population. And here are a few reasons why. Race concordant care. Research has found that patients are more likely to comply to the treatment recommendations of a clinician who looks like them. Race concordant patient interactions often build trust and restore trust in the healthcare system. They also help address language barriers. For example, Spanish-speaking patients are more likely to comply to the medical treatment given from a provider who speaks Spanish. Research also tells us that even if a patient doesn't experience a race concordant visit, that they are just as likely to comply to the treatment recommendations if the provider is culturally competent. Many of you have heard the term cultural humility, which suggests that we are in a constant phase of learning and that curiosity and an eagerness to learn more really makes a difference with the patient interaction. Also, improving access to care. We know that low socioeconomic patients often have trouble accessing quality health care. Investing in programs that diversify the medical workforce improve access issues as UIM clinicians are more likely to practice in low-resourced, historically medically underserved communities. Next slide, please. So we talked a little bit about the who. Now let's talk about the why. Why is ACLM targeting HBCUs? for the Academic Pathways program. Well, we've done our research and we've done our homework, and we understand why this is an incredibly important audience to build relationships with. And here's why. The majority of Black health professionals are graduating from HBCUs. Historically, Black colleges and universities have played a crucial role in educating in the education and training of Black health professionals. And here are some key takeaways. So, nursing programs, for example, HBCUs offer a range of nursing programs that are designed to make America's healthcare system more diverse and equitable. The healthcare workforce. HBCUs have been leaders in producing African American health professionals, with top HBCUs investing heavily in expanding their teaching capacity and developing innovations to address health equity and the impact of racism in underserved communities. And one more thing I want to mention is not on the slide, is around diversity and enrollment within HBCUs. HBCUs have been critical in addressing health disparities through the education of marginalized populations. So, in summary, HBCUs continue to be a vital resource for training the next generation of Black health professionals, contributing to a more diverse and equitable healthcare workforce. Next slide, please. So, let's talk a little bit about how ACLM is currently engaging with HBCUs. Well, currently, lifestyle medicine board certified clinicians support all 4 HBCU medical schools. In addition, 3 of the HBCU medical schools are a lifestyle medicine residency curriculum site. We're proud of the important work we're doing to get lifestyle medicine in the hands of medical students and physicians and residents. As an organization dedicated to the power that the interprofessional team has in delivering care, we know that lifestyle medicine curriculum in health professions or UME programs is a game changer. Nurses, PAs, nurse practitioners, occupational therapists, and other specialists fill gaps in care every day. It is equally important to arm these health professionals with lifestyle medicine tools, resources, and opportunities for board certification. Next slide, please. For almost 5 years, ACLM's HEAL or Health Equity Achieved Through Lifestyle Medicine initiative has supported ACLM's health equity strategic priorities. Community engagement is one of the 4 priority areas of the HEAL initiative. This priority area helps us think through the various stakeholders within the community that support patients. HBCUs are a stakeholder as we think about training and educating the next generation of health professionals. Next slide, please. Another priority area for the HEAL initiative is culturally responsive care. And we do this through our HEAL Initiative Scholarship Program, which was designed to diversify the lifestyle medicine workforce. ACLM offers this scholarship annually to UIM clinicians who are implementing lifestyle medicine programs in communities of need and who are needing board certification to take their programs to the next level. To date, we've funded more than 100 scholars, and more than 80% of them have gone on to be board certified in lifestyle medicine. Next slide, please. So now I'm going to turn it over to Brittany Wilkerson, a previous HEAL scholar who is now board certified in lifestyle medicine and implementing the Academic Pathways program as faculty.
Hi, everyone. My name is Brittany Wilkerson, and I would like to first start by thanking the American College of Lifestyle Medicine and for you all for being here today to discuss my personal and professional journey to obtaining certification in lifestyle medicine. Next slide, please. I'll first begin by talking a little bit about my background. I am from Arkansas and I attended Philander Smith University, which is one of the HBCUs in the state. After I matriculated from Philander Smith University, I then went on to receive advanced training at the University of Arkansas for Medical Sciences, and that's where I earned my Master's of Physician Assistant Studies degree at UAMS. After I matriculated through the program and obtained my National Board Certification for PA Studies, I then went on to practice clinically at a local hospital where I specialized in bleeding disorders. And one of the things that I quickly found out is I had a passion for educating patients and helping them to become advocates for their care, and also to advocate for their communities as well. Next slide, please. Okay. One of the other things that I found out in that role was that my interest in education continued to grow. And it was also where I was first exposed to and brought the attention of some of the social determinants of health, which can really impact patient care. For example, if I recommended a patient to eat a good, nutritious, whole food, plant-based meal, that's not always easily available to patients. Some may not have a grocery store that's within a certain distance to them. And so that really helped me to understand some of the factors that play a role into having others to have a healthier outcome. As my interests continued to grow in education academia, I several years later took a role as a full-time assistant professor at UAMS, which is where I currently am now. And about a year into my journey, one of my colleagues recognized my passion for nutrition, which is one of the pillars of lifestyle medicine. And she notified me about the opportunity to enroll in the Hill Scholarship, or apply rather, and I did so, and thankfully was able selected as a recipient. And I really value the Hill Scholarship because it really aims to address health disparities by training healthcare professionals. It supports education in underrepresented minorities, and then also, or excuse me, underrepresented in medicine. And it also provided the opportunity for me to become board certified in lifestyle medicine. One of the reasons why I wanted to do that is so that I could help provide education to others about these evidence-based lifestyle practices so that we can help improve the outcomes of our patients and those in our communities as well. Next slide, please. In order to do so, I had to make sure that I met the requirements of ACLM, and that included having a master's or doctorate degree, completing lifestyle medicine board review course, and there are some other options, but I had to have at least 30 hours of that. And then I also had to make sure that I attended an annual conference, which was approved by the American College of Lifestyle Medicine. I will say, if you've never been to the Lifestyle Medicine Conference, it's an amazing conference where you have a lot of professionals who have the same goal, and it's one of the best ones that I've been to date. After I made sure that I met all of my ACLM requirements, I then sat for and passed the board examination, and now I'm practicing as a certified diplomat, which shows that I am a certified lifestyle medicine professional who's committed to evidence-based lifestyle practices to help prevent diseases among our patients and communities as well. Next slide, please. To give you some background information about what I have done since becoming a Hill Scholar and certified in lifestyle medicine, as I mentioned before, I didn't want to keep all of this wealth of knowledge to myself. And one of the things that I wanted to do in my role as a professor was to help educate other healthcare professionals as well on how they can focus on chronic disease prevention that commonly plague our communities, such as diabetes and heart disease and hypertension. I also appreciated that lifestyle medicine can help with motivational interviewing and helping patients to set realistic and healthy and sustainable changes, and really help to meet people and communities where they are while implementing culturally sensitive approaches as well. I've also had the opportunity to go and speak to others as well, many students, such as from other HBCUs in the state, to help expand their awareness on how lifestyle interventions can help reduce health disparities that can be prevented through those evidence-based lifestyle practices. And additionally, I wanted to do that to help support diversity in the healthcare workforce. And I've been able to do that through my lifestyle medicine training and becoming certified. Next slide, please. This role in lifestyle medicine has really helped to broaden my professional opportunities, and which is great because this is something that I'm so passionate about. And in my role as a professor, I've also had the opportunity to have a secondary faculty appointment in culinary medicine where I'm able to share the knowledge about lifestyle-based chronic disease prevention with other healthcare students, such as medical students and pharmacy students, and discuss those social determinants of health with others so that future clinicians can better understand the challenges that patients and others in the communities face, and how we can help meet them where they are to set realistic and sustainable goals to improve their health. And lastly, I'll share that just in my growing interest in lifestyle medicine, I've also received another opportunity to pursue my PhD degree in health promotion and prevention research. And I'm currently in my second year of the program, where I'm learning more about some of the public health challenges in greater detail, and how behavioral and cultural factors influence chronic disease prevention, and how we as lifestyle medicine focused healthcare professionals can help improve the health and long-term well-being and quality of life for those in our community through lifestyle-based chronic disease prevention measures. Next slide, please. And so in reflection, I would just like to share that through my journey to obtaining lifestyle medicine certification, it really has helped to strengthen and deepen my ability to connect real-world patient needs with clinical care, and additionally empower students and also myself to lead change so that we can improve the health and well-being of others in our communities, and opt chronic disease outcomes through lifestyle medicine. Next slide. And lastly, again, I would like to thank you so much for the opportunity to speak with you all today. And I'd like to introduce our next speaker, who's Dr. LaTaya DeJesus, she'll go on to explain about her path to board certification.
Thank you, Brittany, for that introduction. I also want to thank the American College of Lifestyle Medicine for the opportunity to share my journey to certification and what I'm doing now as a lifestyle medicine and primary care provider. So I'm going to go ahead and share my journey with you. And it started, as we will see from the next slide, in 2018, and brings us actually up to today. So in 2018, as you can see, I was working as a emergency room nurse. On the next slide, I was talking about seeing a lot of patients that kept coming in for chronic diseases that I knew because I was already living this lifestyle. I just didn't know about lifestyle medicine, but I knew these chronic diseases could be managed and reversed with lifestyle and behavioral changes. But it was tearing me up because I didn't know how I was going to help my patients. I didn't know how to actually put that into practice. So I did know, for one, that I needed to be somebody's primary care provider. So in 2019, I actually went back to school to get my DNP, and I went to the Ohio State University, which did not have a lifestyle medicine curriculum. This was not where I learned about lifestyle medicine, but I was actually introduced to lifestyle medicine this same year by my current mentor, Dr. David Drozik, and he brought me into American College of Lifestyle Medicine. I've been attending conferences ever since. In this video here, you just see where I just have a passion for lifestyle medicine. This is my favorite conference. This was from last year, and I will be attending again this year. I am an advocate for it. I work at a hospital now that has a lifestyle medicine department. I'll get into that a little bit more coming up. In 2020, on the next slide, I actually was able to start incorporating lifestyle medicine. I'm sorry, in 2022, yes, and start incorporating lifestyle medicine into practice. I got my master's and started working in primary care. And I was also blessed to be a recipient of the Heal Scholarship that year, and I was able to get my board certification. And that was actually my most coveted certification. I actually shed a tear. So in 2023, I opened my own private practice for lifestyle medicine. It's virtual, and actually see patients across the country where I'm able to help them reverse chronic diseases, and it's been very rewarding for me. So in 2024, I was convinced to come back into primary care, and you can play this video as well. And one of the reasons why I went ahead and did that is because this hospital does have a lifestyle medicine department, thanks to, again, my mentor, Dr. Drozik. And so I am able to see patients primarily for lifestyle medicine and also use a lifestyle medicine approach first when I'm caring for my own primary care patient. So I'm going to share with you a little bit how I do my visits. A lot of times patients are referring themselves, and they can find me through the American College of Lifestyle Medicine. I'm also listed on Plantrition and the Physician Committee for Responsible Medicine. So on the next slide, this is how my initial visits go. So I see one new patient a day, and those visits run about 90 minutes. And they're referred for several different types of reasons, but primarily most of my patients are for obesity. Now, being certified in lifestyle medicine, I do have patients that I see for depression and anxiety or for substance abuse as well. Those initial appointments, I am using my InBody 570 scale to weigh them. We watch some videos, and you'll see there on the side where it talks about the initial appointment agenda, a few other things that I do. But most importantly is I tailor my plans specifically for my patients. Not everyone, has the same life or setup. It's not a cookie cutter thing. So we create SMART goals. And for those who are not familiar with SMART goals, SMART stands for specific, measurable, achievable, realistic, and time. And I do give my patients my personal phone number because I want them to feel comfortable reaching out to me if they have any questions on their journey. And no one has abused this, but they just feel like they have someone in their corner and they have that accountability. I do have them follow up in a month. And when they do have that follow-up visit, it runs about 30 to 40 minutes. And I'm just doing, going over their SMART goals. This time I might refer them to our pharmacy program, which is specific to this hospital, where patients can actually have fruits and vegetables given to them for a year. And depending on what stage of the follow-up they're at, they might follow up again in 4, 6, or 8 weeks. On the next slide, I'm going to share with you some of the handouts that we go through. So this is our 4 for More, and this is based on the EPIC study. And again, this is specific to the hospital that I work at. But this sheet here is really what guides our SMART goals if we go a SMART goal route. The next sheet that I'm going to show you is provided by the American College of Lifestyle Medicine. It's the Lifestyle Assessment Short Form. I have my patients do this at every visit so I can compare between visits and see how their improvement or how we need to make adjustments. The next handout that I give them is our diet and nutrition screener. And this one I really like because it's a lot more detailed. And this form and the last form is the only 2 forms that they will repeat at every visit. And so I'm able to see how they're doing. And this one shows us how much of what they're eating is considered whole foods, and then how much of what they're drinking is considered water or herbal beverages. So you see that percentage down there at the bottom. On the next slide is just going to be showing you some of the handouts that I provide. Each patient gets a folder with some information in it. We don't go over everything in each visit, but they might have questions when they get home, like how much is the serving size, or what are considered legumes. So they have those handouts and resources for them. I also, on the next few slides, you'll see that there are some recipes. These are recipes I make in my own home. I include them in my patient's packet, so they have some options of something easy they can try and start out with, something that tastes good, that's healthy. Even my 12-year-old, he makes these Marry Me chickpeas. Like, that's his go-to meal. It's so quick for him. It's very easy. So they just have a lot of different resources there. I don't have a reflection listed, but I do want to just encourage you to provide lifestyle medicine as an option to every patient, every visit. And this offers them that they're able to make an informed decision because they know all of their options. And then know your resources, know who's certified in lifestyle medicine in your area, become certified yourself, and then know where you can find those providers on the different platforms. American College of Lifestyle Medicine is one of them. Know where you can get handouts, websites that are going to be useful for you or for your patients. I think of one that comes to mind right now, Dr. Michael Greger's nutritionfacts.org. And then be a believer yourself, live it for yourself. A lot of times when we are doing something ourselves, we're even bigger advocates for it. So I thank you so much for your time and attention, and again, the opportunity to talk with you today. I'm going to go ahead now and introduce the next speaker, Zipporah, and she will be able to share with you how what she's doing and how she got into lifestyle medicine. Thank you.
Thank you so much, LaTaya, for the intro and sharing about your expertise. And a special thank you to the American College of Lifestyle Medicine for the opportunity to share about my experience with lifestyle medicine. Again, my name is Zipporah. I'm an occupational therapist, educator, and board certified lifestyle medicine professional. Next slide. So Grant and colleagues published a research study earlier this year highlighting that when Black patients are cared for by providers who share their cultural background, they experience better communication, stronger partnerships and goal setting, and higher quality care. For me, this evidence resonates deeply with my why. I have witnessed far too many family and community members struggle with complications related to chronic conditions that were often preventable or at least manageable with the right support and resources. These experiences fuel my commitment to expanding access to equitable healthcare and health promotion solutions so that more people, especially from underserved communities, receive the kind of care that truly meets their needs and improves their quality of life. And so when we think about expanding access, this includes equipping future healthcare providers with the tools needed to address the chronic disease epidemic. And so within my most recent academic position, my role focused on developing and implementing interprofessional lifestyle medicine content into graduate level curriculum. So I'll spend the remainder of my time discussing the steps that I took from materializing the integration of lifestyle medicine into the curriculum. Next slide, thank you. So this is a broad overview of the steps that I took to integrate lifestyle medicine, starting with building a foundation for implementation. So in 2021, I began by deepening my own expertise in lifestyle medicine through attending lifestyle medicine conferences. And I echo what Brittany shared, it is the best conference that I've ever attended. And also I began pursuing my certification, and this helped me to better understand the core competencies firsthand. Next slide. I then began by exploring the possibilities of integrating lifestyle medicine into an occupational therapy doctoral program's curriculum. So I began by reviewing the discipline's education accreditation standards to identify where lifestyle medicine would naturally align with the professional requirements. So the next few slides will show some examples of this. So this ACOTE standard, and for occupational therapy, that's the Accreditation Council for Occupational Therapy Education. This standard prepares occupational therapists to address the important personal factors and the impact of those factors on lifestyle choices. So the expectation is not that you read this word for word, it is accessible online, but just to show how an accreditation standard aligns with lifestyle choices. Next slide. And then this ACODE standard identifies the role of occupation. Occupation, also referred to as meaningful activities that occupy one's time. So this is showing how occupations relate to the promotion of health and the prevention of disease, illness, and dysfunction. So in these two examples, you can see how there are professional education standards that directly connect to using the 6 pillars of lifestyle medicine in practice. So using this information, I reviewed existing courses to see what content already covered lifestyle-related skills and where enhancements could be made to integrate more of that content specific to the 6 pillars of lifestyle medicine. And so I just want to pause at this point and say, even if you're not an occupational therapy educator, I still encourage you to review your profession's accreditation standards for similar themes related to the impact of lifestyle choices, health promotion, and disease prevention. And so essentially these steps that I took are not discipline specific. And a lived experience example is that due to some unforeseen programmatic changes in my academic position, I actually ended up shifting my focus to integrating lifestyle medicine into the physical therapy doctoral program following these same steps. So after making this transition, I met with the program director to present the benefits for students, the program, and ultimately patient outcomes. So in terms of students being equipped with best practices, and being able to utilize the integration of lifestyle medicine as a marketing strategy, them being able to pursue certification without any addition to their tuition, but being able to graduate with on the path to certification. Um, Following this, I then worked closely with course faculty to identify the best fit for integration, ensuring relevance as well as feasibility. So next slide. So together we introduced content through guest lectures. I also provided faculty with resources to develop sustainable curriculum elements. And this picture here was captured during a class in which my students experienced the 6 pillars of lifestyle medicine for themselves. So a physical therapy colleague and I designed 6 stations highlighting each pillar of lifestyle medicine, allotting students about 15 to 20 minutes to engage with each pillar. And we were able to create a portion of this experience using the ACLM Taste of Lifestyle Medicine grant. We were able to purchase fruit for the nutrition station. So here you see the students are preparing fruit kebabs. Other stations incorporated mini naps, highlighting the importance of sleep. There were also art projects as a strategy for stress management. And then there were other valuable opportunities for social connection integrated throughout this experience. And so this is lifestyle medicine in action. And the great thing is ACLM offers an abundance of resources, which will be covered a little bit later on in this webinar. So next slide. So in parallel with these steps, I spearheaded a partnership with ACLM, working closely with Kelly Freeman, the Director of Workforce Development, and Western University of Health Sciences to become the first Doctor of Physical Therapy program recognized as a part of the ACLM partial academic pathway. So next slide. In addition to this, I've had the opportunity to publish and present nationally and internationally on lifestyle medicine, health equity, and the psychosocial needs of marginalized groups. And this work has also led to me becoming the inaugural occupational therapy in a rural community, utilizing lifestyle medicine approaches to support individuals that are living with serious mental illness diagnoses. And then lastly, I've been able to partner with organizations to provide education in community settings focused on viewing lifestyle medicine principles as self-care. So in conclusion, as you're taking in this information, I really encourage you to think about the small but realistic ways that you can begin integrating lifestyle medicine into both your curriculum and practice, or maybe even just recognizing the ways that you already are, and thinking about ways to expand on it. Because by embedding lifestyle medicine competencies into professional training, we have a unique opportunity to not only strengthen our own individual fields, but also to transform the culture of healthcare delivery as a whole. And finally, remember that while ACLM offers a wealth of training and resources, which is wonderful, your personal passions and lived experiences are just as important. When you bring those into your teaching, into your practice, your curriculum and your intervention delivery becomes more authentic and more impactful. So I thank you again for the opportunity to share my experience, and I would like to welcome my esteemed colleague, Meryl Fury, to share her expertise.
Well, thanks so much, Zipporah. It is inspiring to hear what you've been able to accomplish in PT and OT. Thank you very much for doing that work for us. I'd like to thank ACLM for offering this webinar, and to everyone who's attending the webinar, just for having be here and your attention. So my name is Meryl Fury. I have been a public health nurse for 30 years. And when I was in school, there were no academic pathways for lifestyle medicine. So this type of work has always been my passion, and I had to kind of figure it out on my own. Well, let me tell you, if that's something that you have struggled with, you don't need to struggle. There is actually a mechanism where you can work in lifestyle medicine and make a difference, and ACLM has that mechanism. I can tell you, had it been available, I would have jumped at the chance for certification. I've always been interested in it. It's always been my passion. Now I lead a nonprofit that's 100% focused on lifestyle medicine, and mostly we educate about using food as medicine. I'm also on the leadership team for the HEAL initiative that you've heard mentioned several times, and I'm a HEAL scholarship recipient, and I will sit for the board exam this year. ACLM is an amazing organization, and lifestyle medicine is the kind of work that keeps healthcare professionals engaged. I work with children and adults, and I can tell you, people that I meet are hungry for this information in conjunction with conventional care. They want to know how to take care of themselves. And just small pivots in a person's lifestyle can make a huge difference, and that patients can see and feel quickly, leading to positive outcomes that last. Next slide, please. As a public health nurse, I've always worked with health equity for underserved populations. And because of this, one of the most valuable and rewarding aspects of lifestyle medicine for me is reaching into the community and working directly with people who need the support that nurses can provide. We call this aspect of lifestyle medicine community engaged lifestyle medicine, or we call it CELM. It has 4 characteristics, and Stacia mentioned them a little bit earlier. I'll describe a bit about a couple of them. Community engagement and cultural responsiveness, I'll get into a little bit more deeply in a bit, but intersectoral partnerships, we rely on this. We connect with faith-based organizations, other nonprofits, schools, clinics, boys and girls clubs, anywhere we can reach the target audience. And then multi-level approaches are key to having interventions with staying power, because we ourselves are not the only people in the community. They interface with other people. The patients interface with other people and other organizations all the time. So if we can interface with them as well, it makes the work easier. Next slide, please. So let me describe an educational series we just launched called Culinary Medicine for Sickle Cell Warriors. Now, this is my why. I love marrying my purpose to my work. Being a public health nurse and leaning into health equity through community engagement is a perfect fit for me. Now, my mom had sickle cell, and as far as I knew, she only had the trait, but she suffered from the disease-related pain and hematuria. I also have sickle cell trait, and this disease has always been an important part of my life because of that. You know, you've heard it earlier, and I'm sure you've heard it multiple times. We often say we have to meet our patients where they are. One way is to go into the community, the school, the church, the summer camp. And for this program, we collaborate with a pediatric nurse practitioner from the University of Illinois. She specializes in sickle cell management. She has deep reach into the Illinois sickle cell warrior population. And knowing that on average, warriors live only 52 years, their lives are very difficult, with frequent trips to the emergency department because of pain crisis and sudden and life-threatening blood flow issues, and that 70% of warriors receive disability and are therefore living just above poverty level, and that there are very few medications or treatments for them. Well, this friend of mine, the nurse practitioner, and I created this program, and we hold it on the west side of Chicago. Thankfully, we were able to get wonderful grant funding for this program, and we launched the first series just a few weeks ago. Now, it's surprising to know that very often sickle cell warriors do not learn much about their condition, even though they've been dealing with the effects of the disease since infancy. So the first part of each class that we hold is a didactic on the pathophysiology of sickle cell. We keep it basic, but information filled. Yes, thank you. So we keep it information filled in a way that people can access. We don't talk in high medical terminology. We're keeping it basic. Group members, not yet. Group members share and everyone feels supported. During the classes, we learn about inflammation, oxidative stress, and hypermetabolism, which are 3 hallmarks of the disease. Next slide, please. Then we dive into food as medicine for sickle cell disease specifically, what to eat, what to avoid, and why. We talk about antioxidants and anti-inflammatory foods, as well as show how to pack in nutrient-dense and calorie-rich whole foods that will help with hypermetabolism. Attendees receive emails every week with the recipes and other coordinated materials and handouts. From a variety of sources, we're pulling from everywhere to support this population. We also have a private Facebook community for attendees only. Next slide, please. Then the class gets together and cooks, and we eat family style. We share problem solving, opinions, questions, stories, and aha moments. Now, about cultural responsiveness. The lessons have to make sense to the participants. And because we're working with food as medicine, the recipes have got to be on point. So the recipes have to meet strict criteria so that they are culturally competent and relevant, and they have to be specific, like I said, for sickle cell warriors. They are culturally palatable. We make sure the taste profile, the flavor profiles are good. They have to be nutrient dense and calorie rich. They have to be low cost, and they have to be easy to prepare. Next slide, please. The ingredients also have to be readily available. We use only whole plant foods, except for a little bit of olive oil. We do not use animal products at all. We use antioxidant rich and in a wide variety of colors. So you can see from these pictures, we're eating the rainbow. And most of all, the recipes have got to be delicious or they will be rejected, which we don't want to do. So we are very careful about that. Next slide, please. Now, this was our inaugural series. It was a really big success. These are some of the participant comments. Like, I met 2 friends here. Now I don't feel so alone. One of the issues that sickle cell warriors face is isolation. So this person was able to come and find people that she shared commonality with. Now I understand why I'm so tired sometimes. I never knew it was a part of having sickle cell. This person didn't understand the pathophysiology of her disease and the constant need for more energy. And the last one, I just love this. Now I read ingredients labels. You have totally ruined Rice Krispie treats for me. I cannot tell you how happy I am that they are reading labels and that I personally ruined Rice Krispie treats for this guy. Made my day when he said that. Next slide, please. So we go into healthcare because we have a passion for helping others. Lifestyle medicine allows us to work in that passion, thriving and making a difference that aligns with what and who matters most to us. This type of work, I'm going to say especially for nurses, this type of work spells pure joy. There is nothing like helping people turn their health picture around, like going from portrait to landscape, or from way zoomed in on symptoms and problems and dysfunctions to zoomed out on life and living. It's literally why we get up in the morning. So professionally speaking, we couldn't ask for more. Now I'll hand it over to Kelly to tell you about how you can wrap your arms around lifestyle medicine starting now. Kelly?
Thank you so much, Meryl and Zipporah, Brittany and LaTaya. Next slide, please. So we're going to talk about ACLM's academic pathway for health professions programs. And Stacia shared quite a bit in the beginning, and I'll just take a little deeper dive for you and also give you some resources. So as Stacia mentioned, this is for master's and doctorate health professions programs, and the students that are in these academic pathways ACLM approved programs will be either partially or fully prepared to sit for the certification exam once they graduate. And all programs do start out as partial academic pathways, and then those that want to can proceed to becoming full academic pathways. So there are many different types of health professions programs that qualify for the ACLM academic pathways. These include any type of nursing program, PA programs, occupational therapy, physical therapy, speech and language pathology, pharmacy, dentistry, nutrition, dietetics, public health, psychology, podiatry, and there are others as well. So if you have any questions, if you have about a specific program you would are wondering if it will qualify, just ask me. So there are numerous benefits to the program and the university. For example, we will go ahead and put your program's information up on our website. We have a directory for that. We'll also put your logo on our main academic pathways page. So you can use this as a marketing tool. You can utilize the logo that we give you to share. And what we're finding more and more is that students are seeking lifestyle medicine strong programs. So you will be showing and demonstrating that you are one of those, that you teach in one of those programs. As far as the benefits to the students, so they'll receive this content related to lifestyle interventions, lifestyle medicine while they're still in school. And then once they graduate, they will be eligible to sit for the certification exam. If they go through a partial program, they will have met one of the prerequisites towards certification. And if they go in a full pathway, that they will meet both of the educational prerequisites to sit for the certification exam. There are benefits to you as well. First of all, we have multiple resources available for you, and some of those I will share with you in a moment. Also, you'll get the opportunity to network with faculty from all over the country that are doing this type of work, and then you will be able to teach the evidence-based lifestyle medicine content within your course. So the application process is fairly easy. Simply scan the QR code, and then you'll see the web page that has all kinds of information for you, including some other videos that you may choose to watch that with other faculty that have shared about their academic pathways programs. And then you will upload the checklist, fill it out, download the checklist, fill it out, and then upload that and your course syllabus to our application portal. You'll receive a response back from ACLM within a month. And regarding regarding the process of getting approval, what this looks like is that we base this on the 2022 competencies of lifestyle medicine. And so as long as your course has content that represents at least 25% of the core competencies, then we will approve your program. And all of these competencies are evidence-based. It's normally a pretty light lift to get your program and your course approved for the partial academic pathway. However, if you don't quite meet the threshold, we do, again, have many resources for you to help you do this. So let's talk for just a moment about those resources. First, we have a Connect page where you can connect with other faculty from across the country doing this work. And then we work very closely with Ardmore Institute of Health. In fact, they were a major supporter of getting the academic pathways up and running. So they have multiple tools for you on their website, including some grant opportunities and the Full Plate Living offering, as well as a documentary called PlantWise that you can show to your students. Then ACLM has lifestyle medicine student interest groups, and if you might be interested in forming one of these, you can scan the QR code here and get more information about that. There's also a Lifestyle Medicine 101 curriculum that is an open educational resource for you that you may sign up to receive. And this includes 13 slide decks of information for you, and it goes along with Dr. Beth Frady's Lifestyle Medicine Handbook. And also there is culinary medicine curriculum that's available to you, including large variety of videos. These are all free for you to use and to share with your students. And for more information for that, just scan the QR code. Finally, we collaborate with the University of South Carolina to offer LMED, which is lifestylemedicineeducation.org. And this is a series of case studies and slide decks and recordings, webinars that you can utilize within your courses to teach about lifestyle medicine. So check out that library. It can be very helpful to download some of that material. Finally, that we've talked so much about the academic pathways and getting your students prepared for certification, but also you can become certified in lifestyle medicine. So on this slide, it lists a few of the requirements in order to do so. And if you have any questions about this after exploring the certification page, please feel free to reach out to me. We also offer support to our academic pathways faculty to help get you prepared for certification. So if this is something you might be interested in, we just put a link in the chat, and go ahead and fill out that form. I will get that information and keep you posted on any opportunities that are available for you for the 2026 certification exam. Finally, I'd just like to thank you for attending this webinar and for all of the speakers sharing their stories. It was just so inspirational to hear from everyone today. And again, please reach out to us if there's any questions you might have. Stacia Johnson, her email is sjohnston@lifestylemedicine.org, and mine is kfreeman@lifestylemedicine.org. Thank you so much.